Timing wise, we're trying to wrap at 2:45.
Okay.
So depending on how we're progressing with questions, I might have to omit one.
Okay, yeah, no problem. Sounds good.
Thanks. Back up here. All right, are we ready to start?
All good here.
Let me get the go ahead. It comes up. Hold on a second. All right, here we go. Welcome everyone to another exciting episode of Smile Talk, the official podcast brought to you by Aligner Co., your go-to for affordable, easy-to-use clear aligners that help you get the smile you want without ever leaving home. Today we're diving into a topic that's not just about looks, but about health, your smile alignment. Joining us is Dr. Derek Weigand. Dr. Derek is a pioneer in modern dentistry, blending hands-on clinical expertise with innovative teledentistry. Licensed to practice in over 25 states, he has been the forefront of expanding access to dental care through virtual platforms while maintaining active practice in restorative dentistry, implants, sedation, and orthodontics. He serves as the managing clinical director at Fargo Moorhead Dental and Dentures, and also consults for leading teledental companies such as Bite, Dentula, and Dial Care. Today, Dr. Derek will help us settle the big question, which one's better when it comes to your oral health choices? Are you ready to go, Doctor?
I'm ready. Yeah, thank you so much. Thanks for having me. Thanks for the introduction. That was really nice.
Hey, where it's deserved, right?
Thank you.
All right, so the first question we're talking about today is a morning routine. Some brush before breakfast, others after. Which routine sets up the teeth for a healthier outcome?
Yeah, that's a great question to start with, and one that's very, important to me and near and dear to my heart with all the patients that I see on a daily basis. But yes, after is the answer. That it would be much better to brush your teeth after breakfast. The timing of it is important. I would say too that having especially if you're eating something sugary or acidic in the morning, like if you're having orange juice or eating fruit or something like that, that sort of thing is kind of acidic and kind of hard on the enamel. So in those instances, it would be better to maybe wait for a half hour or so. I just have this image of somebody like drinking orange juice, drinking coffee, eating a bunch of fruit, and then in a rush to work, and they're just violently brushing their teeth before they head out the door, and that sort of thing is not super healthy for the enamel. So if there's not as much sugar or acidic, you can be pretty safe to just have your breakfast and go and brush your teeth and be on your way. But yeah, that combination of acidic stuff and then just like in a frantic rush to get to work or get to school or whatever, and you're just like going to town on your enamel, it's not the best. So
so safe to say, if you brush after, brush gently.
Yes.
All right, that's
great.
And
the less acidic the better, and the less sugar the better, truthfully. But yeah, I mean, it's all my kids are big into cereals and stuff like that are loaded with sugar. So shamefully, I allow that sort of thing to take place in my own home, and it's just the way it goes sometimes. But yeah, after definitely, brushing your teeth after breakfast would be very much the best thing to do. It would be somewhat of a fool's errand to brush your teeth and then have breakfast right afterwards. So
yes, that's true. Some of us just do a shake and we're out the door. So
yeah,
we have to brush before then.
That's true. Yeah, that's a good point. Yeah.
All right. Well, thank you for that.
Yeah.
All right. So next we're moving on to crowding versus gap. So which misalignment has more impact on oral health, and maybe some details around that?
Sure. Yeah. Also a good question. Crowding would be the one that's hygienically more challenging to deal with. Just having teeth that are stacked on top of one another, and it would be harder to clean in those like nooks and crannies, and having spacing. I mean, I can't believe I'm going to admit this, but if you had spaces between all of your teeth, like you wouldn't really even have to floss, and because the toothbrush would take care of it for you. But yeah, crowding would definitely be the one that's more challenging hygienically, and which is why orthodontics is great and aligner co is great, and so correcting that crowding would be hugely beneficial hygienically for sure.
Absolutely, because even naturally, straighter teeth or corrected with aligners, then you get like a natural gap that should be there, and then it's easier to maintain. So obviously for crowding, realignment, if they're too far apart, lucky them. But if you've had braces to pull them together, it's still best to, clean them.
Yes, exactly.
Wonderful. All right. The next one, we're moving on to whitening, a hot topic right now. Should alignment be addressed before cosmetic whitening?
Ideally, yes. It would be much better, more beneficial to straighten your teeth first. Again, just because crowding complicates whitening. It also complicates hygiene, like we talked about. So if there's plaque or buildup in between the teeth, it's much harder to. It would, I suppose, you could whiten that sort of thing, but it just wouldn't. It wouldn't be of great benefit. So yeah, definitely, that's what most people do anyway. Like a lot of the patients that I have that are in conventional braces, brackets and wires, they as soon as you get those you get all that hardware off and you finish braces. Sometimes there's it looks like patchy, almost like where the bracket was. It's not exposed to plaque, and that sort of area. That area stays really clean and white, and then around it you'll see stain. And sometimes, if the hygiene's really poor, we try to avoid those situations. But if hygiene is really poor, then you can even get decay around the brackets, which is an even bigger problem. But most of the time, when people finish braces, their teeth are so nice and straight, and then they want to do whitening afterwards, and it makes perfect sense. So, and it's a perfect time to do it too.
Perfect. And I know even with Aligner Co, you can actually do aligners and still whiten at the same time. So you almost have the benefit of just being a one and done and getting it all white, bright, and straight.
Yes. Yeah, exactly. Wearing those trays is like, there's no better way to whiten your teeth with hydrogen peroxide or carbamide peroxide or one of the whitening ingredients than putting it in a tray. And that's what whitening trays do. And clear aligner trays, incidentally, are very similar to those and can serve kind of a dual purpose and in that regard. So yeah, it's a really great way to do it.
Perfect. All right. Our next question is along the lines of front teeth versus back teeth. So if we have a front tooth misalignment versus a back tooth misalignment, which one affects oral health more, if there is a difference?
Yeah. So, I mean, both obviously are important. Front teeth, I think would be more the cosmetic concerns. Sometimes if it's extreme, it can affect speech or that kind of thing, developmentally, especially in youngsters. But back teeth is where most of the chewing is done, obviously. So that sort of thing, if there's a crossbite, that can affect chewing. It can also cause problems with TMJ and jaw symptoms from that. And so that part, I guess, from long-term perspective, like throughout someone's life, something that can affect you from misaligned teeth, back teeth would probably be the ones that are more important to get the bite dialed in just right. But then aesthetically and cosmetically, it's your front teeth are definitely the money makers in that regard as far as the smile. So that's for better or for worse, vanity, I think oftentimes drives us to those sorts of things, and that's totally okay to boost your confidence or something like that. But yeah, I mean, again, we talked about hygienically how important it is, and that would be similar for back teeth and front teeth. But yeah, it would be again like long term, and for trying to avoid TMJ symptoms that can sometimes be somewhat debilitating for some folks that I see suffer with it. And it would be the back teeth that would be really important to get those dialed in just right. So,
is it possible to even address the back teeth without aligning the front teeth, or is it kind of lucky for us it's all in one?
It's kind of, yeah. I mean, there are ways, temporary anchorage devices and things like that, where you can do like, where you could just specifically move one tooth if you wanted to, but you could address it piecemeal, I suppose, and just one problem rather than all of the problems. But braces work so well, and clear aligners work so well, honestly, in aligning all of them that, and a lot of times those adjunctive methods are more invasive and sometimes even more expensive and more time consuming than just doing everything together anyway. So that's often not an approach we take, but it's usually better just to, like, if you're going to align your teeth, just align all your teeth. So.
Absolutely. I'm all about that one and done and just get it all nice and straight.
That's right. Yeah.
Money makers and the chewing part too.
That's right.
All right, early minor correction versus waiting for major correction. How does timing influence the long-term health and even the cost? How does it impact the cost, the investment?
Yeah. No, it's just like any other condition that's better treated early. The earlier you make that decision to correct misalignment, to straighten your teeth, whether it's for vanity or cosmetics or a confidence boost or whatever it is, or whether it's something that's very symptomatic or physiological in some way, that's speech development or whatever. It's the earlier the better. It would be the answer to that. So.
That's good to know. Yes, I oftentimes think about, prevention being preventative versus reactive to something.
Yeah, that's such a good point. Yeah, I had a mentor tell me a long time ago, and it's a kind of a famous quote, that an ounce of prevention is worth a pound of cure. It's so important. It really is a good. You brought up a really good point about prevention. It is a preventative treatment that you can prevent so many future problems by treating something minor early on. It's a really big deal.
Sure. Yes, and I would assume also correcting that bite could then reduce the risks of PMJ or other alignment issues and concerns that then therefore impact your entire bite and everything.
Yes, 100%. All of those downstream effects can often be avoided by treating it early. Yeah, for sure.
Right. Early prevention, everybody.
Right.
All right. Well, that was obviously quite a bit of insight and lots of great information. Thank you very much for breaking it down so clearly for us. I think that's the biggest thing, is just clearing some of those misconceptions or even those assumptions that we have. So hearing it from an expert is very, very helpful. So we appreciate your experience.
Sure. Yeah. Thank you.
All right, for everybody that's watching, now it is your turn. We're going to go ahead and start looking at the questions. If anything is on your mind that you want to take advantage of Dr. Weigand's time here with us, that he's so graciously been here with us, we encourage you to send your questions so that we can ask and get those answered right here and right now. All right, let's see.
Also,
yes.
Did you notice my shirt?
Yeah. What you got?
Festive, right? Yeah, some palm trees.
I love it.
In North Dakota, we have to do whatever we can do to.
North Dakota, what is your weather even like right now?
It's actually, well, today is pretty windy, but it's like in the 50s, I suppose. So not, for North Dakota, that's not brutally cold.
Okay.
We're pretty tough, and so it's a pretty nice day actually. But
that's great.
but it's just starting for us. So we've got like several months of long, cold, miserable, dark days, and
yes, we're still in the upper 80s, low 90s.
oh
So
gosh, oh.
it's okay, cooler weather one day. All right, so I got a question for you.
Yeah.
Can I do a liner treatment? I have teeth gems.
Oh yeah, sure.
Not quite sure.
Yeah, like, oh yeah, sure. Okay, so cosmetically, she has some. Okay, yeah, sure. That I don't think that would be any kind of concern. She sounds like has some jewelry on her teeth, and that would be just fine. I can't say I've encountered that yet. But I have any number of patients who have gems on their teeth, but I don't want to say any number, but a handful.
Okay.
But I haven't treated them orthodontically. So, but it wouldn't keep me from doing it. There wouldn't be any issue there as far as they're bonded pretty snug to the tooth surface and have a high bond strength from what I'm aware of, and I don't think there would be any issue with that at all. So
that's great. I wonder, even just like with the aligner mold, like when we take our mold, if it would actually just contour right around it and kind of fit it.
Yep. Mm-hmm.
Okay, there we go. So great question.
That's a good question.
That in, and then also a great answer for those that are wondering, and again, how that aligner may conform to it, and then you can still keep it and get your teeth straightened. All right, do aligners need to be cleaned every day?
Yeah, that's a really important part of it. We might have addressed this topic before, but yeah, I mean, we all harbor a lot of bacteria in our mouths, and so whenever you're wearing something in your mouth for any period of time, it would be important to clean it every day. There's all sorts of like ultrasonic, like a jewelry cleaner almost, that you can use to clean aligners. That you don't necessarily have to do that, but even just running them under warm water and using some kind of brush, a toothbrush or a denture brush or whatever, would clean them just great. But they do need to be cleaned.
Yes, kind of like brushing your teeth. You also want to get the bacteria out of your liners because they're hugged right up against it.
For sure. Yep.
All right, another question for you. My mother is 60 years old. Will aligners be okay for her as the teeth in this age may tend to grow weaker?
Yeah. Typically, unless there's some type of problem with the tooth, like the tooth isn't really any weaker with age. I can certainly understand that there's wear and tear and teeth, a lifetime of chewing cycles on teeth. There's sometimes you see little fracture lines or something in the tooth surface, but they're just because someone's lived a lifetime with their teeth doesn't disclude them from doing orthodontics. I think I'm trying to think of the oldest patient I put in clear aligners. They were well into their 80s though, so you can do it anytime. So yeah.
No, that's great. I love the beauty of aligners because some people just feel like, oh, I'm too old for braces. It's just you don't typically see it in the older population. So at least aligners, help with that whole social vanity side of it, I guess you could say.
Yeah. And good on somebody for wanting to do that at that stage in life. Like that.
Absolutely. You're never too old to better yourself.
100%. Yeah, I completely agree.
Go grandma. Let's get it done.
That's right. Yeah.
All right. Another question is, I have crowns. Can I get a liner treatment?
Mm-hmm. Yeah, absolutely. Yep. No concern there. In fact, it's most providers I think would prefer if someone had crowns that they would choose clear aligners over bonded brackets and wires, conventional ortho, because it's really hard to bond brackets to porcelain, and so they're ones that we have to continuously rebond. They keep popping off,
that's frustrating too.
Clear aligners, you don't have to worry about that, and they move the teeth just as well, and whether the teeth are crowned or not. So absolutely, someone with crowns can do clear aligners.
Perfect.
Yeah.
All right. Are retainers the same as aligners in terms of material?
Very similar. Sometimes retainers are slightly thinner material and slightly less rigid, just because it's not actively moving the teeth. It's just trying to hold them in position. So there's not nearly as much force that's required. But it is very similar. And for all intents and purposes, aesthetically how they look and that kind of thing, they're almost identical. So.
Great. All right. So good to know. All right. Let me see here for the next one. This has been really good. Very helpful. All right. How about this one? This is something we haven't touched on before, I don't think. I have a missing tooth. Can I still get treatment?
Yeah, absolutely. Even if a lot of times when teeth are missing, the adjacent teeth will drift or shift and kind of move into the empty space. A lot of times we end up doing orthodontics because the person may have had the tooth removed years ago and they're finally deciding they want to replace that tooth. Well, now the adjacent teeth have moved into that space and there's not enough space to restore the missing tooth with whatever you choose, whether it's an implant or a bridge or partial denture. And so sometimes we have to move the teeth to open that space back up for restorative needs. Absolutely. And if the space is perfectly maintained, then those teeth can still be included in the clear aligners, but just kind of not any active force be put on them. And then that patient can choose down the road if they want to replace the tooth or not. And then a lot of times too, we take out when people have limited space because they just have too many, too small of a mouth or too many teeth for their mouth. We sometimes extract teeth orthodontically to create space. Yeah. So absolutely, you can wear clear aligners if you're missing a tooth.
All right. Very, very good. Yeah. All right. So this is kind of the opposite. I have severe crowding. Can aligners treat it?
Very likely, yes. And I've said this so many times now. I'm always so amazed at what you can accomplish with clear aligners. Like it.
Good.
I always, also want to preface that with there are limitations. There are things that clear aligners, cases that they're just not suitable for. But those cases are, I find, few and far between. Like most often. Even in extreme crowding or extreme severe spacing cases, even to fix someone's bite, sometimes an overbite or an underbite or a crossbite, those clear aligners work really well. So, we probably have to look at the case. Obviously, each one of these is kind of a case-by-case basis, and we look at every one. But I'd be interested to see it for sure, and I would bet that that case could be treated, and sometimes maybe even if it's not something that's fixed perfectly, like drastic improvements can be made, and maybe there's still a tooth that's flared here or there, but we can a lot of times fix the smile line at a very minimum. So
that's great. Very good to hear. Yes, I'm sure just then that type of situation may be impacted with time. It might take a little longer, in each tray, of course.
Yeah, right.
So, okay. Yep. Yeah, there's no way to measure exactly how quickly teeth move, correct?
Yeah. Everyone's different. I mean, I always kind of give people that range of like 6 months to a year kind of, and probably more that like 9 months to a year kind of time frame. But some people just, they're so compliant, they're so good. And for whatever reason, their teeth just move super quickly. A lot of times in younger patients that teeth move much more quickly. Sometimes, you have drastic improvements and you finished a case in 6 months or less. And then others can take a year or two or more.
Wow. Yes.
Take a long time. But
my son was young, but he had to have a spacer put in to help with the bite alignment, and it didn't take as long as they had anticipated. So, but I mean, it was young, and we were compliant, and things moved pretty quick, and thankfully they're holding. So we'll go with that.
Yep. Yeah.
All right. Can braces cause oral infection, and basically due to trapped food?
Yeah, they can. If that's why like the hygienic component of that is so important to be diligent about that. It can lead to, if you're just constantly holding food and plaque and bacteria up against the tooth surface or the gum tissue, you can get decay, and that can lead to infection, or you can get just gum inflammation, gingivitis, or it could lead to full-blown gum disease too. So keep those things clean.
Yes. So all the more reason that someone who's not already they're not compliant with, dental care, it might be the best thing for them to have aligners that they can remove and clean, brush, floss, and then pop them back in.
100%. Yeah. We've talked about this. Like it quickly becomes, it's just so much more enjoyable for a provider to see too, like when someone doesn't have all that hardware that they have to clean around. It just makes things so much easier. And a lot of times we're treating teenagers or teenage boys tend to be the worst about cleaning their teeth. Not to throw any group under the bus, but I was a teenage boy once and was not very good at my own hygiene.
Time for that.
Yeah, right. Yeah,
it's a good thing dental insurance doesn't charge more for boys like they do car insurance, right?
Yeah, seriously.
Oh my goodness, these boys. All right, so this individual had braces as a kid. Now, can I get aligners, and how long will it take? So I'm assuming maybe something has shifted. Maybe didn't wear those retainers afterwards.
Yep, and that's what clear aligners are like. This is where they shine. Like someone who had misaligned teeth, went through orthodontic treatment, and then for whatever reason that just retention didn't work, or they lost the retainer, or the retainer debonded, or they just didn't wear the retainer. Then teeth have relapsed, and it's time to straighten them again. Clear aligners are perfect for that. And again, with the time frame, it's really hard to predict, but oftentimes, hopefully it's not as bad as it was before they went through.
Right. Don't undo all that hard work.
Yeah, I mean, it relapsed some, but it's maybe not like 100% of lost cause, but it can take, again, 6 months to a year, or more in severe cases, but.
All right. Well, that's good. Yes, I'm sure even after having braces that, it's a bit of a sensitive subject as far as like, oh, I don't want to go through that again.
Yes.
Yeah. And so they're a little more, I don't want to say, hesitant, but maybe a little more like, oh, I'll just put it off as long as I can. But anyway, so, all right. Well, big thank you to everyone who sent in questions. We loved hearing from you guys. And of course, we're here to guide you every step of the way, however we can. That's why we bring experts in to answer these questions. Dr. Weigand, we really appreciate you walking us through the real reasons behind common smile concerns, and more importantly, showing how treatable most of them are with the right approach, obviously. All right, and that's a wrap for today's episode of Smile Talk. If you learned something new today, be sure to follow us and share this episode with a friend who also could benefit from it. And remember, you can always send your smile questions for future sessions. All right, everyone, thank you for tuning in. Keep smiling, and we will see you all next time.
Awesome. Thank you, everyone. And thanks so much, Leslie.